Cerebral palsy is a childhood physical disability affecting movement and inability to do a normal function. With over 40 years of experience, I'd like to give an overview of what this cerebral palsy is. My name is Dr. Krishnaya. I work in KIMS Hospital as orthopedic surgeon, Secunderabad. This is how a cerebral palsy child typically looks like, and you see how difficult he has to walk. He requires two people to support him to take steps. What is this cerebral palsy? Well, it is a disease or injury to the child's brain resulting in impairment of muscle function, leading to deformities, physical disability, and loss of muscle coordination. As you see in here, this child has both arms and legs affected. He is unable to stand firmly, and with that crooked and spastic and stiff hands, he will have terrible difficulty in doing regular tasks in day-to-day life. 3 children out of 1,000 live births are affected with this condition. Unfortunately, most common in poor families. It is commonly due to lack of proper care during childbirth, resulting in loss of blood supply to the child's brain and resulting in damage to that part of the brain. Many times you see a typical child like this. You need to understand how normal brain and spinal cord functions before we go into understanding what happens in cerebral palsy. As you see in here, in that orange area, that is the part of the brain that controls muscles in the body. And those controls or signals from that part of the brain come through the spinal cord via various nerves to the muscles, and therefore the muscles are told to do particular tasks in a coordinated way. Like as you see in here, if you want to hold that ball, the signal from your fingers go to the brain via nerves, and from the brain, the signals come again through the nerves, spinal cord and nerves, to the muscles, and those muscles will act in such a way so that you do that particular task. In cerebral palsy, what happens is different parts of the brain are affected, and depending on which part of the brain that is affected, and accordingly, those parts are malfunctioned and have difficulty in functioning, as you see in the shaded area. And this particular child has both arms and legs affected. That's why he stands very difficult, with a lot of difficulty, crossed legs, and fingers are very, very tight, and he cannot open the fist. And he has all the 4 limbs, that is legs and arms, affected with this disease. How do they present? Well, they present at birth normally without any crying. A normal child cries after birth, but child affected with cerebral palsy doesn't cry. There'll be delay in normal milestones like speech, walking, or even neck holding are going to be much delayed compared to normal child. And again, as the child grows, there is a lack of coordination of movements, and he is unable to do daily tasks like eating, dressing, sitting, walking, etc. And some of them even have difficulty in expression because their facial muscles are affected. And some of those children also would have fits, convulsions. And you see in here, this particular child has terrible difficulty. 10 years, she is 10 years old, requires 2 people to take steps, even then those legs don't support her weight. There are a variety of causes for the cerebral palsy. As I said, birth injury, difficult delivery, temporary loss of blood supply to the brain will cause damage. And there could be infections and other diseases that affect the child during pregnancy while in the womb. And children born with low birth weight prematurely also have high risk of cerebral palsy. And unfortunately, this is very common in poor people. We often confuse this entity with polio because they look alike, but polio is different. Polio children are normal at birth, and it is infection that affect the spinal cord and causing damage to the spinal cord. That results in a complete loss of muscle control with very loose muscles, as you can see in here. But their developmental milestones are normal. And this is how a classical cerebral palsy, polio child looks like that. Well, India has done extremely well. 27th of March 2014, World Health Organization has declared that India is completely polio free. So we don't have any children below 9 years with, if you see such deformity, it is cerebral palsy, it's not polio. Thanks to aggressive eradication program, vaccination, etc., now India is polio free. However, this dreadful disease still rampant in African countries, especially sub-Saharan African countries. Cerebral palsy requires early diagnosis. It is a non-progressive condition. By doing routine screening in children, we can pick up these children and then start treatment much at an early stage, which is very effective. And also, it will help in secondary effects like deformities. Mind you, the primary problem is in the muscle stiffness, and then that will gradually result in joints malfunctioning and deformities and disabilities developing. There are treatment goals for these children. The primary aim is to prevent the deformities and to improve the function so that the child becomes preferably self-dependent or at least semi-independent. That's reducing the burden on the parents and the society. Once the child is treated and put to useful function, and the child can take care of himself or herself for the rest of the life, and thus relieving the burden on the family, which most of the times are poor. But there are varieties of treatments available. Physiotherapy, injections, Botox, they're a bit expensive, but sometimes they work. Some children require calipers, splints, wheelchairs, crutches, etc. Surgery is a very effective treatment. Many children would improve tremendously with surgery. After that, they require rehabilitation. That means putting the child to some useful work. Primarily in physiotherapy, the aim is to improve the function and strengthen the muscle, and thus improving the coordination. Physiotherapist also teaches the parents to continue physiotherapy at home because these children require very long time physiotherapy on a regular basis. And they do stretching of the joints and improvise the function. And acts like this will help the child to develop finer movements and improvise their coordination. Group therapy and teaching parents is a very essential part of treatment because in groups, children enjoy physiotherapy and learning from each other, and they don't feel like it's a specialized treatment, it's part of fun, and parents also learn a lot. These are some of the splints we use to hold those deformed limbs. But surgery is a very important aspect of treatment. Here, you correct the deformities, thus improving the function. Early surgery is effective, preferably before 5 years. Multiple surgeries in single sitting is preferable. I'd like to emphasize that most surgeries are simple and inexpensive. This is the important point. Before surgery, we make assessments, what type of surgery is required, how many surgeries required, and then during surgery, most of the times we do release of those tight muscles and correct the deformities. And the child will be put to rehabilitation after surgery and physiotherapy to develop skills to do daily tasks and improve the function, and thus improving the self-confidence. And therefore, they can become self-dependent. Some children may require special education. In this particular issue, support groups are extremely important. Because the moment the parents know that the child has cerebral palsy, there's going to be tremendous devastating news. They require emotional support, preferably from parents who had cerebral palsy children and professionals who have special experience in this. And thus you give moral support. And many of these parents in this country require financial support as well. The support groups also raise donations and help in advancing the treatment pattern. In the Western countries, many cerebral palsy children who have acquired this through difficult delivery, they get a lot of money by medical claims or suing the hospitals and doctors. But in this country, unfortunately, there is no such facility, and quite frequently we see cerebral palsy child with a mother like this. Public awareness is badly required. Very little is known in this country, and group gatherings like this in public places and wearing t-shirts will bring awareness about this condition. These children, many of them mentally and intellectually, they are good. They have this physical disability. Their intellectual function, sensory function is quite good. So society has to understand this, and public awareness programs like this would help. In our experience, we get last 40 years we've been treating children, and in this country I get children brought to me by voluntary organizations, missionaries like this, as you see in here, uh, or sometimes we conduct camps, go out into the community and examine the children and pick up those children. And once we pick up, some of them may require simple physiotherapy and they do well, others require surgery. We make assessment preoperatively, what surgeries they require, how many surgeries they require. And then like this, after full assessment, we prefer to do surgeries in groups because these surgeries are done absolutely free, and we have to coordinate with hospitals who are willing to give us free services. And many of these surgeries we have done in the past in medical college hospitals and government hospitals and charity hospitals, like in groups. After surgeries, we put the children in a plaster cast for some time to make sure that those released muscles heal well, and after that they walk. And I must tell you that this is the most happiest form of surgery. I get tremendous happiness by doing this, and these children and their parents are so grateful. So a physically challenged child deserves as much as a normal child. Thank you.